Several Triad nurses headed to Western North Carolina to give healthcare workers there a much-needed break so they could focus on their own recovery from the storm. WFMY News 2's Hannah Jeffries spoke with the Cone Health nurse who just got back.
This was Peyton Blanchard's first time helping out in a crisis situation. She told me it was hard to hear these people's stories and see what they were going through, but was happy she was able to help in their time of need. Blanchard left for Western North Carolina last Friday with a fellow nurse. She says they worked for 3 days in a community hospital. Their goal was to give WNC hospital staff a break so that they could deal with their own troubles.
There's another nurse who's almost 70 years old, and he's hauling 5-gallon buckets of water from a creek in his truck to his house so he can flush the toilet. So the hospital itself is in decent condition, but hearing their stories about what they're dealing with, like another nurse had to drive almost 3 hours to get to work because of all the road closures. So it's definitely affecting their everyday lives.
While she was there, Blanchard worked her normal role as an emergency department RN. When she got there, initial injuries from the storm were mostly over with. However, impacts from Hurricane Helene brought about different challenges.
Something that we did see was every time we wanted to give a patient a prescription, we had to go through, is this pharmacy open? Is this one open? Do they have power? So trying to get access to those outpatient would definitely be a challenge for people right now.
So far, Cone Health says it has sent 15 RNs west to help out in the emergency department and labor and delivery unit.